Many couples dream of having a precious little boy or girl, but for some, getting pregnant is a challenge. Dr. Marwan Sheikh, I thought that was yours. Sorry, Dr. Marwan Sheikh has been helping couples conceive since 1985.
And he's brought along one of his patients, Jessica Freeland, today to talk about a procedure that can restore fertility for some people. Dr. Sheikh, thank you so much for being here. We're going to get to the story and the technicalities of everything that you did to bring this little one along. But first, Jessica, congratulations.
Thank you.
Who is this cutie pie?
This is Miss Sophia. She's 11 months.
And so tell us a little bit about your story.
Well, I'd gotten remarried, and my husband was never married and didn't have any children. So after we got married, we decided, you know, to go see Dr. Sheikh and try to have another baby. I had my tubes tied in 2004.
Okay.
And for a lot of people, they think once the tubes are tied that's kind of irreversible. Is that right, Dr. Sheikh? But that's not true.
That is true. Well, that's not true, but it is true sometimes. It depends on how they were tied. Okay. So that is a problem in the sense that sometimes patients pay a lot of money to have the surgery done, and when you go in, you find that the doctors basically took the whole tube out, which is a problem.
Oh, wow.
Yeah. So what did you do here to bring this little bundle of joy? What was the procedure that you did? As she's looking at you, smiling, saying, thanks, Doc.
Well, basically, as she said, her tubes were tied, so we went in and we cut the middle portion of the tube where it was tied and hooked them together with a very, very tiny suture, smaller than the hair. So we have to use microscope and big magnification to be able to put them together.
So this isn't really invasive. It's a pretty easy procedure per se, right?
Well, it's surgery. It takes about 3 hours to do it under the microscope and general anesthesia. So it is in a way invasive, yes. But patients do well. They go home the same day. With modern anesthesia and modern technology, these patients don't have to stay in the hospital like they used to in the past.
What is the success rate for tubal reversal?
It can be 5%, it can be 90%, depending again on how much damage the tubes have and where they were tied.
And who obviously is a candidate? Is this someone who had their tubes tied, or I mean, who would be the person that would be looking to have this procedure done?
Somebody who's had their tubes tied and they're in a new relationship, or for some reason they had their tubes tied 10 years ago and they had only one child. They want more children. They changed their mind.
Yeah.
And that's kind of what happened here, right? You have two older?
Yes, I have an 8 and a 14-year-old.
Look at this smile. Look at this. She's like, yep, I'm cool.
And we have news too. You have another one now on the way.
I'm currently 15 weeks. So
very cool. Congratulations. Yeah, you're excited about that. This is so much
We're going to find out whether it's a brother or a sister. What,
possibly
later?
today.
Maybe today?
Maybe.
Maybe. That's
very
so exciting.
Cool. She is so adorable.
What is the cost for something like this?
$5,000.
Yeah.
And
but there is you're going to do a special for First Coast Living
viewers.
Yes, for the special is they get 5% off that price.
Yeah, and they can come in too and get a consultation, I'm sure, and talk with you about what the situation is and find out if it's an option too.
Yes.
So
how has this been for you? Just to be able to now bring the new baby in with your new relationship and everything.
Oh, as soon as we made a decision, I never regretted it. I mean, it's surgery, and yes, it took recovery, but this is what you get out of it. So
yeah, little cutie and another one on the way.
Yes.
Well, fantastic. Well, thank you both for being here.
So many stories, huh? Every
know.
time you come, you've got a bundle of joy and a bundle of stories.
That's right.
All right.
That's right.
Thank you so much.
Thanks so much.
We'd like to thank Assisted Fertility for sponsoring today's segment.
And for more information, you can go to their website, which is assistedfertility.org, or you can call them at 398-1473, and the website there again and the phone number are on your screen.